At this EADV Congress, I have myself given a presentation on psoriasis in elderly. And in earlier days, we thought when people are older than 70 years, it is not so important anymore whether there are a few psoriasis plaques. But we now know, also from quality of life investigations, that in older patients, psoriasis really can impact quality of life tremendously. The other aspect in my presentation was the following, that is comorbidities. Comorbidities, especially cardiovascular disease, metabolic disease. More than 50% of people older than 70 years have hypertension, and nearly 50% have abnormal lipids in their blood, and that is a lot. And therefore, in elderly patients, we have indeed to look for comorbidities. And then, with respect to the treatment of psoriasis, I have given in my talk an overview what treatments can be used in elderly. Well, actually, all treatments can be used, but with topicals and with phototherapy, sometimes it can be too much for elderly people to do the application. It can be too much every day, and it takes a lot of effort to put on the ointments or 3 times a week to go to a treatment center for phototherapy. Nevertheless, it can be given, but it may ask something from the patient. Then, treatment of acitretin, the retinoid acitretin, may cause hyperlipidemia, and that is already a comorbidity in psoriasis. But therefore, you can give it, but you have to look extra at serum lipids. Cyclosporin, we should be aware that elderly people have less functioning of the kidneys, and that cyclosporin may decrease even this functioning of the kidneys. So I'm not so happy with cyclosporin in elderly people. Methotrexate can be given, but with methotrexate, we should look carefully at kidney function, and when kidney function is somewhat less, then we should know that actually methotrexate blood levels will be higher, as methotrexate will be less eliminated. And now with biologics. With biologics, actually we see that maybe there are slightly more infections during biologics. And we have also noticed slightly more other side effects, but these were very seldom. It was only slightly more. And when we study these side effects, it is actually just for a reason that these people are older. And older people have more morbidities, have more diseases. And then it is at the end of the day, is it not adequate to say, well, that the drug has done it. It is elderly people have a higher chance for some morbidity. So, in the follow-up of the treatment of patients with psoriasis, be ambitious. Take attention to the comorbidity. In your treatments with biologics, realize that this is a safe approach. There are several biologics along. The anti-TNFs may have some impact indeed when there's tuberculosis endemic or patients are inclined for infections. I would not give adalimumab. Actually, the treatment with ustekinumab is very favorable in elderly people, can be given with high safety, as well as the anti-IL-17s and anti-IL-23s. So, treatment of elderly in psoriasis, be ambitious.